Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop rotator cuff tendonitis. But before I do that, I will briefly go over rotator cuff anatomy, what is tendonitis, the symptoms, the causes, and the risk factors, because these understanding will help us to really get to the root cause of the problem, and then we'll go over the steps that can be taken to stop the rotator cuff tendonitis. So first, what is tendonitis? Well, tendon is the cord that actually connects the muscle to the bone. And you can see it here. This is the supraspinatus, and it's attached to the bone here. This is the tendon, that's where it's located. And the subscapularis here, and it attached here to the bone, and that's the tendon. And you have the biceps tendon is in here. And when you start to have tendonitis, anything ending with itis, that is inflammation. So it's mean inflammation in the tendon here. And I will show it to you in this model actually. So this is a front view of the shoulder. So when you look here, you will see the subscapularis muscle and the tendon of the subscapularis here. This is the white part of, and that's usually the location of the tendonitis, inflammation of the tendon. The supraspinatus in the back here, this is the supraspinatus, and it's attached to the humerus head, the bone of the shoulder, and usually the tendonitis in typically in this area. That's where it's rubbed on the tissue above it. And then you will have the infraspinatus here, and it's attached here. Oops, we don't need that. Okay. Infraspinatus here, and it's attached in the back here. And then we have teres minor, and then teres major that's actually wrapping around and attached in the front. So when you have tendonitis, it's very typical you have it, especially subscapularis and supraspinatus. Some patient could feel it, could have it in the back too. But that's usually the location of the tendonitis in the shoulder. So what are the symptoms of tendonitis? You're usually gonna experience some tenderness around this tendon, dull aching pain, and sometimes limitation in the range of motion. So the symptoms, you're gonna feel it more, especially with the overhead activity, because that inflamed tendon, you really need to have, you don't need to have inflammation or scarring in there. So when you have that, when you move your arm up, that will limit the range of motion. I will go show you an example here. So the shoulder joint should be like this. This is the humerus, the humerus head, and here you have the scapula, for example. So I'm exaggerating with the space here. So normally when you elevate your arm up, you should have that free space so things does not push against each other. So when you have inflammation in the rotator cuff tendonitis, that space decreases. So when you move your shoulder up, you'll start to have more rubbing on the tissue above it, and that causes the tendonitis to be worse and limited the range of motion. Because the rotator cuff muscles should actually compress the head of the humerus to clear it up. But when you have tendonitis inflammation there, that space decreases. Even with the compression, you're gonna cause rubbing more. And the other thing, when you have tendonitis, you start to have weaknesses in the rotator cuff muscles. When that happens, the muscle is not going to work good enough to really depress the humerus head, so it will clear it up. So it's basically, it's going to look like this. It does like this. So this way you will have more rubbing, more inflammation, and more irritation to the rotator cuff muscles. So typically pain with the overhead activity, especially lifting overhead. You will feel tenderness in the front of your shoulder. You will feel pain probably when you sleep on that side that involve, and also might feel stiffness and weaknesses in that side. So what are the causes of the rotator cuff tendonitis? It's very common with repetitive overhead activities, especially if you overtrain with any sports like baseball, swimming, playing golf, and without enough rest and overtraining, that could cause tendonitis in the shoulder. And also occupation that require heavy lifting with the overhead activities. The other reason could be a direct hit that to the shoulder area that actually inflame the tendon and cause the issue. So how to treat rotator cuff tendonitis? In order to answer this question, we need to understand normal healing. So we can treat the root cause of the problem. So I'm gonna go over external paper cut for visualization, but the same process happen internally. We don't see it because the skin covered. So the first stage of healing is inflammation. Swelling, redness, the blood starts to rush to that area and you start to experience pain and decreased function. And by definition, tendonitis is inflammation. It's swelling in the tendon area. So you have inflammation there. The other thing is that overlooked is the second stage of healing, because your body has to go through the proliferation stage in order to heal. And that's the second stage of healing. And as you can see here, your body starts to build the scar tissue, which called fibrosis. Also, during this stage, you start to have muscle spasm, trigger points. Perfect scenario, actually, during the maturation stage, your body should clear up the fibrosis, the fascia restriction, the muscle spasm, and the inflammation, and everything clears out. That could take days, weeks, months, or years. As we get older, the speed of the normal healing process decreases significantly. So when you have chronic condition, your body probably going back and forth between inflammation and proliferation here. So when we look back to the image here, it's not only swelling, usually combined with scarring around this area. Why that happened? Because think about this way, you had a micro tear in the rotator cuff. Your body has to build the scar tissue to glue it, to heal it. If your body does not build the scar tissue, it's a permanent tear. So scar tissue is part of healing. Inflammation is part of healing. The problem is if you have chronic inflammation and if you have excessive scar tissue, that's in the way of everything and will limit the movement and will cause more rubbing on the tissue when you try to lift your arm up. So what should we do to treat the tendonitis? It's not only inflammation, as I said, it's a lot of scar tissue, fascia restrictions, and muscle spasm. So I'm gonna go over some of the treatment that currently used and does not work very well, because based on the study does not provide long-term. And the other thing, when we compare this treatment to the normal healing cycle, it will make a lot of sense why it's not treating the source of the problem. So you don't have to waste your time on something that provide temporary pain relief. First thing is ice or heat. Ice is specifically for inflammation that provide temporary decrease in inflammation. It's not going to be a long term, and it's not going to do anything to the proliferation stage. Electrical stimulation, it's basically temporary pain relief, but does not really do much to any of the stages of the healing cycle. So the other thing that's very commonly used is foam roller and massage. If you used foam roller or massage in the acute stage, it's gonna make it more inflamed and it's gonna cause more scar tissue. So the other issue with the foam roller and massage, based on the studies, several studies showed that it provides even temporary pain relief, does not provide long-term pain relief. And when I go over the fascia system, it will make a lot of sense why massage and foam roller are not effective to treat rotator cuff tendonitis, because with the hand, it's impossible to go deep enough to really release the deep adhesion. And if you cannot apply mechanical force in the tissue to release the scar tissue or fascia restrictions, it's impossible to release it without mechanical force. Okay, the other thing that's commonly used is joint mobilization, but that's basically moving the joint. Someone mobilize it for you. But here is the thing, when we look at the healing cycle, Moving the joint is not going to decrease inflammation. It's not going to break down the scar tissue. It's actually, if it's inflamed, it might cause more inflammation. And based on a study, does not provide long-term pain relief. It's temporary if there is effect. Other thing that commonly used is stretching. So think about this way. You have tendonitis because you have a micro tear in your tendon, and you try to stretch it. That micro tear actually could be a major tear. So that's a problem of the stretching. The other problem based on the study is stretching is actually causing more inflammation. When that happens, it's actually going to cause more scar tissue. So I personally do not recommend the stretching to my patient, and I have a video why you should not stretch. Feel free to check it out in my YouTube channel. There is other safe alternative options that other than stretching, and I recommend to avoid stretching. Okay, so the other thing is a strengthening exercise. It's good to do strengthening exercises, but if you have a lot of inflammation in the rotator cuff, you're gonna inflame it more. We need to introduce the strength exercises in the right time, not when there's too much inflammation, because that's gonna make it worse. Okay, so what should we do to really treat the root cause of the problem? We have to look at the healing cycle and really address the inflammation and the proliferation stage simultaneously. Okay, so if you have inflammation, minor inflammation, you should rest for 5-7 days. Take it easy. Don't do lifting with the overhead activities. Just move freely. Don't restrict your motion, but I will avoid any sports involvement that cause more inflammation or more throwing or basketball. 7 days should be good enough for minor inflammation to calm down and you start to feel better and getting back to normal. But if you still have symptoms, that's a sign you have moderate to severe inflammation. And this is basically where you are if you have severe condition or moderate condition, your body going back and forth between inflammation and proliferation stage. So when that happens, I usually aggressive to break that vicious cycle from both ends. So what I personally use, I use a Magna Heal. It's a very strong magnet that the range is about 3 inches that can penetrate the body 3 inches. And I just have patient wear it. So they can use it with while you walking, sleeping, or throughout the day. The other thing I like to put all my patient on is the anti-inflammatory diet, because there is certain food that actually cause internal inflammation and slow down the healing process. And I like to make sure my patient is on healthy diet so their body will heal fast. For chronic condition that's not healing, and there's other health issue, that's probably a sign of severe vitamins, minerals, or hormonal imbalance. Because if you have vitamins deficiency, for example, if you have B, C, D, or magnesium is a mineral, your body is not going to transition from the inflammation stage to the proliferation stage to the maturation. Your body going to go back and forth because you don't have enough vitamins and minerals that require for your body to transition to maturation stage. So one of the way you can do today, actually take advantage of Ask ASTR. It's askastr.com. It's a free online medical evaluation that takes about 5 minutes to answer the questionnaire, and the software will help you on the tips that you need to take to address some of the deficiency you might experience. The other thing we have to work on simultaneously is the proliferation stage. We have to work on the scar tissue, the fascia restriction, the trigger point, and the muscle spasm. So, and why this is significant, because I want to show you this image. Actually, when you look here, the first image, that's the muscle is nice and healthy. There's no injury here. When you start to have injury, you start to have micro tear, and you can see the tear here. The problem is when your body starts to build the scar tissue, the scarring is extremely random. And sometimes for chronic condition, there is excessive scarring that's in the way of everything. And you actually might experiencing now. I want you to try at home just palpate in your trap here. If you start to feel like a knot, that's probably a scar tissue. And palpate in your rotator cuff or your biceps, and you feel like thick band or like a rock or knot in there, that's a sign of a scar tissue. That means there is excessive scar tissue. When that happens, it's actually glue the tissue together. Everything is stuck together, so you will not have enough contraction in that muscle to really do the work. So what should we do for the scar tissue? It's very simple. What I personally use, I use the A3 to break superficial scar tissue, and I use the A5 to really go deep to break deep scar tissue, and I use actually the A5 also for the trigger points. And that's one of the reasons I said foam roller is not gonna work, because it's extremely superficial. It's not gonna go deep enough to break adhesion. And with massage, if you use your knuckle or you use your elbow, those are very thick. It's not going to go deep enough to really break down the scar tissue. And in order to break adhesion, you have to be on the adhesion side, to go very deep to really release it. Otherwise, you are far away from the injured area or the adhesion side. So the other thing we have to address simultaneously is the fascia system. I'm gonna briefly go over the fascia system because it's extremely important to treat it with rotator cuff tendonitis. And I want you to appreciate how complex this system, because understanding that, you will understand why it's extremely important to release the fascia. So the first fascia layer, the superficial layer, it's like a wrap surrounding the entire body. Spider-Man suit that's wrapping the entire body. And you can see it here, the white tissue here, that's the fascia layer. So to make things complicated, but don't worry, the treatment is very simple. There is actually two categories of fascia, superficial layer and deep layer. And the deep layer, deep muscle fascia layer, is divided to 4 layers. The first layer is the apparatic fascia. It's actually a wrapping a group of muscle. And then we have the epimysin that's wrapping each individual muscle. Then the premiysin that's wrapping a bundle of fibers. And then at the end, we have the endomysin that's wrapping each individual fiber. So to make things more complicated, each of those layers has 2 to 3 sub-layers. For example, the apparatic fascia has 2 to 3 apparatic fascia layers, and the epimysin has 2 to 3 epimysin layer, which make it more complicated, but the treatment is simple. And that's why the massage or the foam roller is not gonna go deep enough to cause mechanical force to do the release. If you're not exerting mechanical force on the fascia layer, it's impossible to release it. So what I usually do for the fascia, I use the A1 to release superficial and apparatic fascia restrictions, and I use the A5 to release the epimysin, premiysin, and endomysin. So to sum it up, what should you do at home? Okay, first of all, if you have minor inflammation, just give it 7 days. Take it very easy. Don't do any lifting with overhead activities. Just move freely, but I will avoid any repetitive overhead activity. I will avoid sports training, just so your body will heal. For moderate to severe inflammation, that's a sign that your body going back and forth between inflammation and proliferation. And if after 7 days is not enough and you still have pain, that is a sign that you need to be aggressive to address the inflammation and address the proliferation stage, which is breaking the scar tissue, fascia restriction, and trigger point at the same time. So if you have any question, leave it in the comment below, and I will answer it in a future video. I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to ASTRinstitute.com.